You've probably had a shoulder rub, a pat on the back, or even a quick squeeze of the neck from someone trying to be kind. Maybe it felt nice. Maybe it felt harmless. But what if I told you that there's a specific area of your body, especially after the age of 60, that should be completely off limits? Not because you're fragile, not because you're overreacting, but because touching this area, even casually, could lead to hidden nerve damage you might not feel right away, but that can quietly affect your mobility, your balance, even your independence. It's not your knees. It's not your hips. It's not your spine. It's an area most people overlook, and yet it controls sensation, muscle coordination, and blood flow to some of the most essential parts of your body. I'm talking about the back of your neck, specifically the upper cervical spine, the base of the skull, and the nerves that run along the top few vertebrae. After 60, this part of your body becomes more vulnerable than you realize. The vertebrae in your neck begin to lose flexibility. The discs between them thin out, ligaments stiffen. The small muscles responsible for subtle movements, like turning your head or stabilizing your balance, begin to weaken, and just underneath those muscles, critical nerves, the greater occipital nerve, the accessory nerve, the cervical plexus, tiny, sensitive, and essential. And when pressure is applied to this area the wrong way, it doesn't take much to cause real damage. Here's the problem. Most people think nerve damage means pain, but in older adults, it often shows up as something more subtle: tingling in the arms or hands, dizziness, balance issues, numbness in the scalp, muscle weakness in the shoulders, or even unexplained fatigue after turning your head. And if someone presses too hard, whether during a massage, an adjustment, or even just a prolonged hug from behind, they can irritate or compress these nerves, especially if there's already some degeneration happening inside the cervical spine. Now imagine you're getting a neck massage. They dig their thumbs into the base of your skull, maybe press around your upper spine. You think it's relaxing, but later that night, you notice tingling in your fingers. The next morning, your neck feels stiffer. You chalk it up to sleeping funny. But what really happened? Micro-trauma to the nerves around the C1 to C3 vertebrae. It doesn't cause screaming pain. It's slow, quiet, and that's what makes it dangerous. This is especially risky if you already have mild arthritis in the neck, or if you've ever had a fall, whiplash, or poor posture from years at a desk. Even slouching while watching TV for long periods can put extra strain on this region. Over time, that strain builds into inflammation. Inflammation creates pressure, and pressure on those delicate nerves leads to dysfunction, not always immediately. But over weeks, months, and eventually years, it adds up. And it's not just massage. Be cautious with how others touch or manipulate this part of your body. Certain chiropractic adjustments that involve rapid neck rotation can be extremely risky after 60. Some studies have linked aggressive neck manipulation to a rare but serious risk of stroke due to the delicate arteries that run through this region. This doesn't mean all chiropractors are dangerous. It means that not all necks respond the same way to force, especially aging ones. Even family members or caregivers should be educated. A well-meaning loved one rubbing your shoulders may drift too far up the neck, not realizing that gentle pressure on younger muscles feels completely different when ligaments are stiff and nerves are closer to the surface. Always speak up. Don't wait until discomfort shows up. By then, the damage could already be underway. So what can you do instead? Protect this area like you would your lower back, or your eyes. Support your neck with proper posture, especially while using phones, tablets, or reading in bed. Use a pillow that keeps your head level with your spine, not too high or too low. Avoid high collars that force your neck forward. If you enjoy massages, ask the therapist to avoid direct pressure at the base of the skull, unless they are trained in geriatric or neuromuscular techniques. Gentle work around the shoulders and upper back is fine, but the upper cervical region, that's a no-go zone, unless absolutely necessary and performed with precision. If any of this sounds familiar, if you felt dizzy after a haircut or tingling after a hug, or if you've brushed off stiffness that keeps coming back, comment "protect the neck" below, because your body doesn't always yell when something's wrong. Sometimes it whispers. And if you're paying attention, you can catch the signs early before they cost you mobility, energy, or peace of mind. Now let's go deeper into what happens when this area, the upper cervical spine, is overstimulated or misaligned in older adults. The nerves in this region don't just affect the head and neck, they also influence your shoulders, arms, diaphragm, and even your ability to maintain balance while walking. That's right. Pressure on the wrong spot in your neck could be why you feel unsteady getting out of bed, or why you're grabbing walls and countertops a little more often than you used to. What many people over 60 don't realize is that small accumulated trauma to this area can create what's known as proprioceptive dysfunction. That's a fancy term for when your brain doesn't receive accurate information from your joints and muscles about where your body is in space. It might show up as clumsiness, hesitation on stairs, needing to look down constantly while walking, or suddenly feeling unsure in dim lighting, even when you know the room. And it's not always caused by obvious injury. Sometimes it's something as small as poor sleep posture. If your pillow isn't properly supporting your neck and head, you may be subtly compressing those sensitive nerves every night. Over time, that compression affects your brain's ability to track your head position. The result? You wake up groggy, stiff, or slightly dizzy. You think it's aging, but it's actually your neck sending scrambled signals. The vestibular system, which helps you stay balanced, is directly connected to your neck muscles. These muscles, when irritated or weak, start sending false alarms. Your brain reacts by tightening surrounding areas, triggering tension headaches, shoulder pain, or shallow breathing. This is why some seniors develop anxiety-like symptoms with no clear emotional cause. The body feels unsafe, the nervous system is on edge, and it all starts in the neck. If you've ever experienced a sudden wave of lightheadedness when turning your head to one side, or a moment of blurred vision while backing up a car, that's not just old age. That could be vertebral artery compression. The arteries that run through your cervical spine supply blood to the brainstem. When the neck is twisted too sharply or extended back too far, it can temporarily reduce blood flow, causing a cascade of disorienting symptoms. This is why health professionals now advise older adults to avoid extreme neck movements, especially during exercise or stretches. That means no rolling your head in circles, no snapping your head back during seated exercises, and definitely no allowing anyone, friend, massage therapist, or trainer, to twist your neck suddenly. The risk simply isn't worth it. So, how do you keep your neck strong, flexible, and safe? First, posture is everything. Avoid the forward head position that comes from hours of looking down at screens. This puts enormous strain on the upper cervical spine. Imagine holding a bowling ball at arm's length versus tucked into your chest? That's what your neck feels like every time you crane forward to read your phone. Bring your devices to eye level. Use a book stand. Train yourself to sit upright with your ears aligned over your shoulders. Second, do gentle neck mobility exercises that don't involve twisting. Chin tucks, shoulder rolls, and light lateral tilts, ear to shoulder without forcing it, can keep the muscles engaged without compromising safety. Focus on improving the strength of your upper back and deep neck flexors, muscles that support your posture and reduce strain on the delicate upper spine. Third, invest in the right sleep setup. A contoured cervical pillow can support your neck's natural curve. Memory foam is ideal for maintaining alignment without pressure points. And if you sleep on your side, make sure the pillow height matches the width of your shoulders so your neck isn't bending awkwardly all night. Fourth, don't ignore early warning signs. If you feel pins and needles in your fingers, dull aching at the base of the skull, or a strange pulling sensation when turning your head, that's your nervous system asking for help. Don't dismiss it. Talk to a physical therapist or chiropractor who specializes in cervical stability for older adults. They can show you how to gently strengthen and protect this area without risking overcorrection. Fifth, communicate with others. If someone goes in for a shoulder rub, politely say, "Please avoid the base of my neck. It's a sensitive area." If you get regular haircuts, mention that you prefer minimal manipulation of the headrest or washing basin. Simple requests like these are worth it. You're not being difficult. You're being protective of a critical, overlooked part of your health. And finally, give your nervous system a chance to heal. Rest matters. Hydration matters. Breathing deeply, especially from the diaphragm, relaxes the muscles connected to the cervical spine. Everything is connected. A tense neck can trigger a tense jaw, shallow breathing, poor digestion, and even fatigue. But with awareness and care, you can reverse that spiral and build a neck that supports, not sabotages, your quality of life. Let's stop treating the back of the neck as a casual contact point. It's not just where tension lives. It's a gateway to your brain, your balance, and your strength. After 60, you don't have to fear your body breaking down, but you do need to respect the small details that keep it stable. If this message made something click for you, comment "my neck, my rules" below, because this part of your body deserves boundaries, deserves protection, deserves your attention before a small mistake becomes a lasting limitation. And if this helped you, subscribe and hit the bell. We talk about the real stuff here, things that get missed, dismissed, or written off as just part of aging. But you deserve better than that. And your neck, it's where better starts. See you in the next one.